Right now here at 5:30, the call is growing louder for one Kentucky state agency to reverse course and make one addiction medication easier for you to get.
Kentucky has the 7th worst overdose death rate in the U.S., and that's according to data from the Kaiser Family Foundation. That's a nonprofit that focuses on health policy research. And you can see here Kentucky in that dark red there. The state has a deadly overdose death rate of nearly 50 per 100,000 people, with the majority being opioid related. That ranks us in the top 10 states, with Tennessee and West Virginia even worse.
Right here tonight, we're going to be hearing from Kentuckians in recovery, doctors, and lawmakers who say an outdated state drug policy will risk even more lives. Isaiah Kim Martinez first takes us to Vocal Kentucky, a grassroots organization working to break the stigma of addiction.
Brittany Morris serves the people of Louisville every single day, reaching those who are unhoused and battling addiction.
Typically, the way we do it is we set up all the bags and then we'll put like chips in each bag.
She's been working at Vocal Kentucky, headquartered just east of downtown, for nearly 3 years. In that same time frame, she became a mom.
She is beautiful. She is almost 3 years old.
Morris says it was when she learned she was pregnant that she made the difficult but necessary decision to get sober.
I couldn't do it after I seen the positive on the test because it was no longer just my body anymore, it was hers too.
Her medication, prescribed by a doctor, was buprenorphine.
It did take away my cravings for other drugs, but I never felt like I was high off of it.
It's better known by brand names like Suboxone, taken to treat opioid use disorder.
Buprenorphine reduces the mortality from opioid use disorder by more than 50%.
Buprenorphine is designed to help with severe withdrawal symptoms. Yet, advocates say its use is highly restrictive in Kentucky, frustrating physicians like Dr. Michelle Lofwall at the University of Kentucky.
The disappointing thing is that very few people with opioid use disorder receive it, and there's a lot of barriers to accessing it.
Republican State Representative Kim Mosier is a retired neonatal intensive care unit nurse.
We're not even limiting the opioids, but we're limiting the treatment. This makes no sense.
At issue is Kentucky's 7-page regulation on buprenorphine. It outlines the rules of when doctors can prescribe it, pharmacies can dispense it, patients can take it, and how much.
You can only have a first dose of 4 milligrams. Well, sometimes we need to give 8.
The Kentucky Board of Medical Licensure, based in Louisville, makes these rules and can penalize physicians who violate them.
It's unnecessary, and we can repeal it, and we should repeal this regulation.
Addiction medicine specialist Dr. James Murphy, testifying here in front of state lawmakers in Frankfort, is fighting to deregulate buprenorphine in Kentucky. He points to the fact that Congress has already taken steps to do so at the federal level. In 2022, lawmakers in D.C. eliminated the need for doctors to get federal waivers to prescribe the drug. But in Kentucky today, that requirement is still there. The board calls them guardrails.
What would you call them?
I would call them burdensome right now. I think that we need to trust our well-trained doctors.
After my request to the Medical Licensure Board to discuss the regulation went unanswered, I went to their Louisville office, where I was told to leave my contact information. A day later, I got a call from Leanne Diakov, the board's general counsel, who told me they would not be commenting on the issue.
If this was a cancer medication or a medication for heart disease, we wouldn't have a problem with it. But I think there's just very long-standing stigma and sometimes frank discrimination.
I asked Dr. Lofwall if there are any dangers to overprescribing buprenorphine.
Yes, there are side effects. We do need to prescribe it safely, but it is safe.
This year, Representative Mosier filed a bill that would have protected doctors from losing their licenses or getting fined by the Medical Licensure Board for prescribing buprenorphine. The bill did not pass.
Do you plan to refile the bill and continue that push this coming session?
I would like to not have to. Putting stricter regulations in place in Kentucky is just not getting us anywhere.
Back at Vocal Kentucky,
So if people need something, even if it's just as little as socks, they come and write their name.
Brittany Morris remembers well the challenges of a few years ago.
There had been times that I had cried myself to sleep because I just wanted to use so bad.
And the difference that having access to treatment made in her life.
I feel like if it wasn't for Suboxone, that I probably would have given in to those temptations. I just feel like we shouldn't make it harder for people to try to get sober.
Her mission?
There's my daughter's handprint right there.
Is for thousands of other Kentuckians to experience the same turnaround and second chance that she did. Now, there was supposed to be a meeting next Tuesday in Frankfort between the state's medical licensure board and lawmakers to discuss the buprenorphine rules and proposed changes to them. That discussion, without explanation, has been taken off the meeting agenda today. It's worth noting overdose deaths in Kentucky are down 30% as of 2024, but more than 1,400 Kentuckians still died from overdose just last year. Isaiah Kim Martinez, WHAS 11 on your side.